Now at 5, more than 100,000 people are in healthcare limbo.
It was just really, kind of frankly upsetting.
Well, tonight they're waiting to see if their health insurance coverage will be pulled. This comes as the fight continues between Anthem, Blue Cross Blue Shield, and Ohio State University hospitals. Less than a month ago, the insurance pulled OSU out of its network for patients with Anthem's Medicare Advantage plan.
Well, now we are learning all patients with Anthem coverage through their employer could be affected. Let's get to 10 TV's Carla Rogner joining us live outside the OSU Wexner Medical Center tonight. Carla, you've been looking into this all day. Tell us more about this potential impact.
Yeah, well, this is happening because OSU and Anthem cannot come to an agreement on a new contract. And while both parties say they're still negotiating that new contract, right now there's about 135,000 people wondering if they'll be covered here next year.
You feel really uncertain.
When Thea Flittner was pregnant with her now 1-year-old daughter, she saw specialists at Ohio State.
I've been a type 1 diabetic for 23 years, and so having a really, really great medical team, such as the one that I experienced at Ohio State, maternal fetal medicine, they take care of women experiencing high-risk pregnancies.
Flittner was one of 135,000 patients to receive this email from OSU on Wednesday, notifying her she may not have care at the hospital next year. Anthem says in a statement to 10 TV, "We are optimistic an agreement will be reached. However, we are concerned that OSU wants to increase its prices for patients and their employers at rates 3 times higher than inflation. These price hikes would increase healthcare costs for Central Ohio by $185 million over the next 3 years. However, Ohio State tells us in a statement, Anthem has underpaid us for the past few years, failing to keep pace with inflation. And our costs to deliver care have risen 45% in the last 5 years. And unlike other insurance providers, Anthem has refused to consider appropriate rate adjustments. Now, with 25 days left to make a deal, Flittner worries about how the change in insurance could impact her if she wants to have another child.
I would definitely want to go back to Ohio State Medical Center, but if they weren't in network, that would make, probably wouldn't be possible for us.
And Ohio State is advising that patients impacted by this keep their scheduled appointments for now. It also says that some people may qualify for continuity of care depending on what conditions they're being treated for here, and they would be able to receive care here for a period of time if that contract does end. Reporting live at Ohio State, Carla Rogner, 10 TV News.